Welcome back to the Rebel Core Content Podcast. Core content for anyone, anywhere, and just in time. This is Swami, and today I want to get into the topic of sinusitis, or more technically, rhinosinusitis. This is a very common condition with about 20 million cases diagnosed in adults every year in the US. And it's the source of 1 in 5 antibiotic prescriptions that adults receive. Although we're going to see that most of those prescriptions are unnecessary. The diagnosis of sinusitis is almost always a clinical one. We're looking for nasal discharge. It may be purulent, it may not be, nasal congestion, facial pain or pressure, especially over the sinuses. Some people will have anosmia or hyposmia. You can have a fever, cough, fatigue, maxillary pain, and ear pressure or fullness. There are some different flavors of sinusitis. The major one is acute viral rhinosinusitis. This is typically caused by things like rhinovirus, influenza, and parainfluenza, and this usually is going to last for less than 4 weeks. The next category is the uncomplicated acute bacterial rhinosinusitis. The uncomplicated refers to the fact that the infection never leaves the sinus. It doesn't spread outside of that area. And then finally, there's complicated acute bacterial rhinosinusitis. This is where there's extension outside of the sinuses and the nasal cavity. We mentioned up front that most of the prescriptions of antibiotics for sinusitis are unnecessary, and that's because the vast majority of these are viral in nature. But how do we distinguish which ones are viral and which ones are bacterial? In the past, a lot of people would put a lot of weight on color change of the mucus, but that doesn't really predict whether it's a viral or bacterial etiology. Viral sinusitis will run its course within about 4 weeks, and they typically tend to have some resolution by about 7 to 10 days. There are rarely fevers associated with viral sinusitis, but if there is a fever, it's going to present early and then go away, even though the patient has continued nasal congestion and discharge. When we're looking for bacterial sinusitis, we're mainly looking for patients who haven't improved within 10 days of onset of symptoms, or if they have worsening symptoms after about 5 to 7 days. In addition to that, if they are continuing to spike fevers, continuing to have purulent discharge, an increase in facial pain after about 3 or 4 days, those are things that are more concerning for bacterial sinusitis. So the big delineation is that viral sinusitis will have a fever early, but then it goes away. They tend to have some resolution within 7 to 10 days, although they might have more prolonged symptoms, they're not getting worse. If you see the patient worsening after 3 or 4 or 5 days, then that is more likely to be bacterial in nature. And definitely if they are spiking fevers beyond the first 4 to 5 days, we are more worried about bacterial sinusitis. The IDSA takes all of this into account and recommends that patients should be treated with antibiotics if they have persistent symptoms without improvement for more than 10 days, they have severe symptoms for more than 3 to 4 days, or they have double sickening. This is the situation where they get better and then start to get worse again after a couple of days. First-line antimicrobial therapy is either with amoxicillin 875 milligrams twice a day for 5 to 7 days, or doxycycline 100 milligrams twice a day for 5 to 7 days. For second line, you could use something like amoxiclav or levofloxacin. And of course, just because we're not treating the viral sinusitis with antibiotics doesn't mean we're not doing anything. Decongestants can be very helpful here. And while we do have oral decongestants, things like pseudoephedrine, I actually find more benefit with intranasal medications. I like to combine intranasal saline to try to flush out the sinuses and then pair that with an intranasal corticosteroid like fluticasone. The most important thing to take away in all of this is that the vast majority of acute rhinosinusitis is viral in nature, antibiotics aren't necessary, and we should be antibiotic stewards. We should really be considering which patients need antibiotics and understanding that most with sinusitis don't. But again, the things that we are looking for are persistent symptoms beyond 10 days, severe symptoms for 3 to 4 days, and the double sickening. That should prompt antibiotic therapy as we outlined above. Before we wrap up, let's hit with some quick take-home points. Number 1, acute rhinosinusitis is a clinical diagnosis. Number 2, the vast majority of acute rhinosinusitis cases are viral in nature and don't require antibiotics. And number 3, consider the use of antibiotics in select groups with severe disease or worsening symptoms after initial improvement. That's all for the Rebel Core Content Podcast this week. We'll be back in 2 weeks for another cast. In the meantime, don't forget to pop on over to the site and check out all the great posts from our faculty. And until next time, stay safe.